and setting the expectation about what's to come relative to it being May 1, and also as we focus on the reopening of the city of New Orleans, moving towards the end of our proclamation that I have had in place for some time now. We know everyone is eager to reopen, no doubt about it. It's not going back to normal. It's what we're calling here the new normal. Today, we currently have 6,495 positive cases in our city with 437 deaths in Orleans Parish. I gotta this is something, a new one I've gotten from Claudia Regal from our mosquito and control board. So I have my bugs all over, but I'm gonna pull it just for a second. 437 deaths in Orleans Parish. And New Orleans remains a leader in this country as it relates to cases on a decline, as well as our deaths, which is a big, big sign that we're moving away from community spread. We have taken a deeper dive, as we shared with you earlier, last week, about our mobile testing sites that we have stood up last week in Gerktown, Holly Grove area, this week in partnership with Jefferson Parish in Marrero. Again, our focus is on meeting people where they are, and the people are truly responding to that. One indicator that we have noticed based on the level of testing, but also as relates to the processing of those tests, the majority are coming back negative. However, we are continuing to identify positive cases in the city and in these particular areas, which is why we are going directly there. So we're doing what we intended to do, and again, meeting people where they are, and they are responding. I want to take this time to remind everyone that you must wear a mask when you are going about your way, whether you're an essential employee or you're going as a customer to receive services. You must wear your mask. As you heard also, relative to the RTA, we've added more buses on the line because we do see just an uptick in regards to the number of residents who need that level of transportation services. To respond to that is why we put more, again, buses on routes. In addition to that, making it very clear that it's mandatory that any of our riders, all riders, wear masks to protect them, as well as, again, our employees and other riders that may be on a streetcar or a bus line. Do not let this good weather fool you and just attract you to moving away from the city's mandates that are in place. The stay-at-home mandate remains in place, and it will be as we move towards that May 15th date. More to come on that. As I've indicated, it will be the data and not the date that will drive not only decision-making, but also that phased approach to reopening the city of New Orleans. At the end of the day, what happens now, meaning as we continue to adhere to the stay-at-home mandate, it will again determine how prepared we are as a city to reopen and reopen again in a phased approach. Today, we are outlining what those guidelines will be for the city of New Orleans, and I'm going to ask Dr. Jennifer Avegno to walk you through those steps right now. As you know me, I come and I move in and out of these updates, and so you'll hear more from me later. But at this time, I do need to bring forth Dr. Jennifer Avegno. Thank you.
Thank you, Mayor. As the mayor said, we continue to be encouraged by over 3 weeks of sustained lower and declining cases from our peak in early April. This is a clear sign that our stay-at-home order is working and that fewer people are getting sick. Our healthcare system, I'm happy to say, remains strong and has available capacity. But it is critical that we continue to monitor admissions and the availability of ventilators and ICU beds as we begin to consider easing into this next phase. Virus testing, as the mayor said, has been and will continue to be a top priority for us, as it is in national and state guidelines to think about easing restrictions. In order to safely do that, we will have to be able to consistently test 4 to 5% of our population each month. And for New Orleans, that's about 500 to 600 tests every day. Much of our efforts in the coming weeks will be devoted to maintaining that level of testing through programs across the city. We have had a great first 2 weeks of the mobile testing program that started in Gerttown last week, as the mayor said, and in Marrero. This is our partnership with LCMC Health and LSU Healthcare Network. About 1,900 residents have been tested at those two sites. This program is specifically designed to bring testing to hard-hit neighborhoods that lack access or have barriers to other forms of testing. Next week, we're going to be in the wider Mid-City area Monday through Wednesday, and in New Orleans East Thursday through Saturday. Spanish interpreters will be available in Mid-City and Vietnamese in New Orleans East. We have a schedule for the next several weeks of the neighborhoods where we'll be, and we really want our residents in those neighborhoods to walk, bike, scooter, however they need to get there, and come and get tested. Ready.nola.gov is where you can find that schedule. In the coming weeks, we also expect to stand up additional mobile testing program focused on our most vulnerable residents and residences. We are very excited about this development. We will share more information as soon as it's ready. Our goal is to hit every area in the city where there is a testing need. And we are one of the very few cities, if not the only in the United States, that is able to do this right now. Another key requirement before we can consider easing any restrictions is to ensure we have the ability to quickly isolate newly sick individuals and trace their contacts. You've probably heard a lot about this. We're working hand in hand with the state to ensure robust contact tracing and isolation protocols are in place for New Orleans residents who may get sick. I'm asking all residents, all employers, all workers to continue to do the critical things that we know work and slow the virus. And that is to stay home except for essential needs, to wear a face covering when you're going about your activities, to wash your hands often and disinfect your surfaces regularly. Our phased reopening guidelines are still in development. They take their lead from national and state guidelines, and we are working hand in hand with those partners so we can make sure we are consistent. But I do want to take some time to set expectations of what they will look like. As we've said, this will be a phased approach that will be done gradually, intentionally, and based on data that weighs potential benefits of reopening various sectors against the threats to our community, especially our most vulnerable residents. Key milestones, and these are based on White House and national best practice guidelines, will need to be met before any restrictions are eased. These milestones will be sustained and declining low numbers of new cases, expanded testing capabilities as we've discussed, hospital capacity, and robust contact tracing protocols. Once we feel comfortable that we are able to meet these guidelines, we will then consider moving into phase 1, which will allow some low-risk operations to resume in some fashion. Low-risk operations will have to meet strict social distancing, limited occupancy, and PPE requirements in order to operate. Again, we are currently working hand in hand with the state who are providing state-level guidance on which business operations will qualify as low risk. And they are taking their guidance from national best practices such as Johns Hopkins Roadmap and the White House guidance. So this is all very much in line with what other states are doing around the country. According to public health guidelines, when we talk about risk, we're talking about the amount of contact between individuals in a space, how close or intense that contact is, and the ability of any space or business to make modifications to make an interaction as safe as possible. So just to sort of give you some parameters. We know that certain activities like large gatherings, large indoor groups do not qualify as low risk in any phase 1 guidelines. Also, if you are able to maintain your livelihood while working remotely as an employee, that should continue in phase 1. Once we do safely make the decision to move to phase 1, everyone should still continue to stay home except to engage in these low-risk activities as needed. If at any time there is a spike in cases or deaths or lack of hospital capacity or any of the other markers that we've been talking about, it's very clear we may need to re-implement restrictions to again slow the spread and prevent further deaths. I don't have to tell anybody standing here or listening that this has been a very difficult few months for all of us for many, many different reasons. And it will continue to be difficult moving forward. This is not going to be an easy process. Most of all, though, thank you for all of the sacrifices you've made, that you continue to make to save the lives of your neighbors. Thank you for putting others above your own self-interest. That is how we have saved lives. More than ever, it's important for us to continue to do that and to stick together to care for one another. Thank you.
Thank you, Dr. Avegno. Just to follow up on some of the points that Dr. Avegno made, and really to take it a step further in regards to how the city of New Orleans is preparing to organize stakeholders around a reopening strategy. On today, I'm unveiling the Reopening New Orleans Task Force, which is an internal group that is working with our federal and state partners to outline milestones and phases. And that internal group specifically is just that, internal government, departments. How will we as government, when we have not stopped operating, we've always been open, but when we open back up City Hall, for example, what are those protocols and procedures? Most of our workforce will continue to work from home as we look at reopening, but at the same time, that's why I'm organizing and I've created this reopening task force that looks at the internal operations of city government. In addition to that, that forward-facing or that public-facing will be a Reopening New Orleans advisory panel, in which I'm also creating and unveiling that today. That is comprised of those external partners to create industry-specific recommendations and provide input and feedback. So that process is moving forward as well and will guide me as mayor and our department, our leadership, as well as our business community on how we can reopen and will reopen and uphold public health as our top priority. So with that, I'm going to ask our Director of Homeland Security, Collin Arnold, to come forth, give you an update on, again, things that we're continuing to do on a daily basis to move our city forward. So, Collin.
Afternoon, everybody. The New Orleans Office of Homeland Security and Emergency Preparedness continues to manage our Emergency Operations Center upstairs here at City Hall and our logistics facility at the Smoothie King Center. There we're handling a large quantity of supplies supporting the region's response to COVID-19. As we plan for the safe and phased reopening of New Orleans, personal protective equipment, PPE, will continue to be a top priority. We'll continue to ensure our first responders and frontline workers are protecting themselves, especially as they begin to come into contact with more people, once the stay-home order is lifted. We have what we need right now, but let me be clear, PPE is difficult to obtain through regular supply chains. It continues to be. I want to thank all of the generous donations and donors we've had who've provided far more PPE than we've been able to successfully purchase through standard supply chains. This will continue to be a need for the foreseeable future. On that note, I want to reiterate how important it is for every resident of New Orleans to wear a face covering in public. Governor Edwards' amended stay-at-home order requires essential employees to wear face coverings starting today. And even when the stay-home order is lifted and we move into phase 1 of reopening, we'll be asking everyone to continue to wear a face covering. Consider wearing a face covering the new normal. We've given out more than 100,000 cloth masks donated by Hanes to residents and workers. You can also request and donate cloth masks through SEWDAT, SEWDAT.com. Remember that a face covering can be a scarf, a bandana, or a cloth mask. Please reserve N95s and surgical masks for our medical professionals and first responders who need them most and have the highest risk of exposure on a daily basis. And as I've said before, hurricane season is just around the corner. The New Orleans Office of Homeland Security and Emergency Preparedness continues to work with our state and federal partners to make contingency plans to account for COVID-19 for evacuation and sheltering if necessary. We met virtually as a region this week to discuss our city-assisted evacuation plan, which helps an estimated 35,000 residents who are unable to evacuate on their own. Should a major hurricane come our way, we plan to execute the existing evacuation plan with 2 major changes. Everyone will be required to wear a mask, which will be provided. Social distancing will be implemented to the greatest extent possible, including at the evacu spots, in the Smoothie King Center, and on the buses. And the state of Louisiana is working on identifying additional sheltering sites to increase social distancing and sheltering and spread people out. Because of the complications of COVID-19, it is more important than ever that you have your preparations in place. Make an evacuation plan and gather emergency supplies. Get flood insurance to cover your building and its contents. And please, pay attention throughout hurricane season, and if we ask you to do something, please heed our warnings. It is so clear to me that this stay-home order, New Orleanians have come together during very hard times. I appreciate our residents who have done their duty these last 8 weeks by staying home and slowing the spread. The numbers show it clearly. You've listened and you've done what we've asked you to do. The next few months will be difficult, and I just ask that you continue to care for each other. We will get through this together.
Thank you. We definitely will get through this together, and we haven't gotten where we are now by ourselves. It's been a collected effort, a lot of sacrifice, and to our business community and our small businesses, we understand that real sacrifice. And earlier in the week, I was able to make an announcement with Goldman Sachs and with Hope Credit Union about the $50 million in dollars as it relates to our CDFI community, and again, meeting our small businesses where they are so they can get back to work and even continue to provide payments to their employees. More advocacy will continue from the administration, and it's been because of our hardworking partners, our federal delegation has been working very hard for the city of New Orleans, state of Louisiana, and our local delegation has been right there as well. I absolutely must just continue to thank the public for making these gains. On yesterday, I got an email from one of our Mardi Gras Indians, and he sent me a picture where he was dressed out in his suit, and it was to thank me. He went on to say that he was not in agreement with me when I had to cancel parades and Super Sunday, and very upset even about not being able to parade during a mask during St. Joseph's Day. But at the end, and embedded in there, was that he was so thankful because even during that time, he didn't realize that he was positive with the virus. But it was because of our mandates and because of us taking swift action to save lives. And although we have lost over 437 of our residents in the city, we have to also understand that we've saved hundreds of lives in this process. And that's what it's about, saving lives. We flattened the curve. We're continuing to do that. But it is about saving lives. So with that, I'm going to take questions and answers, and we will then end the briefing for you this afternoon. The new drug Fauci was talking about? Yeah. And not to disrespect.
So remdesivir did get some, or is expected to get some emergency authorization, but it's a very big if. The study that showed there's trials that are showing some benefit to a small number of patients, and it's only available in intravenous form. So if and when this drug is given, and I know that it is being given in ICUs, it is only for the sickest patients. It is not a drug that is expected to be widely available for anybody to take. So while we're hopeful that it does show some effect and can help to save some of our sickest patients, that's really what the use is going to be limited for.
Mm-hmm. Okay. Currently, as it relates to the demolition of the adjacent buildings next to the Hard Rock collapse site, it is on the agenda to proceed to the HDLC. I believe it's May the 7th. Don't get me wrong. I mean, get that straight. Fact check that. But I do believe off the top of my head it is May 7th, which is next week's time. And the city of New Orleans, as you know, has given issued a permit contingent upon some assurances that we had to build in to the process to issuing that permit for demolition. But let me tell you, it's been a long time coming, and I'm just so glad that we have reached a point of agreement to where the safety in terms of the demolition will move forward, and that is preventing more people from dying, as well as retrieving the remains of our two residents who have died. So it's going to, it's a good thing. But I'm moving my family's back. Every time we make progress or we see it, just reopens the wound, so to speak, for the family. And that they're happy to be moving forward and seeing the demolition process move forward. And at the same time, it increases anxiety as we move through that process. But the city of New Orleans, and of course myself personally, remains committed to doing what's needed to provide support to the families associated with the tragedy. Yeah. As it relates to surrounding parishes opening up the sidewalk seating, I believe that was your question. In the city of New Orleans, we're going to stick to the guidelines that are in place, and we're going to look towards the May 15th end of the current proclamation, and we'll let data drive where we go. We believe that we've been very intentional about keeping restaurants, in business. And we believe, based on the guidelines that are currently in place, that they will continue to maintain the level of business and that they have been able to benefit from over the past several weeks. How many weeks now we're in this? Week 8. So we believe, we have 2 more weeks to go, with the current mandates in place. And we're just focusing on that, moving to phase 1, and we're asking businesses to do the same. Start thinking about contact tracing. How are you going to do it and be effective at it? So just focus on getting their guidelines and protocols in place so that when we reopen, that we're seen as the safest place in the United States, not only to visit, but to go out and eat and dine. Well, no, not really. In terms of no, you mean in discussions about what Orleans is doing?
Or just, has there been any back and forth about, like, you think it's a good idea, you don't think it's a good idea?
Oh, no. There hasn't been any of that. It's just been mainly support, for those parishes and for the governor moving forward, in his direction, the direction that he's going in. But there's been no back and forth. Definitely nothing negative, but all positive in regards to sharing and wanting the best for all of our people. But for Orleans Parish, we're going to stick to the mandate that's in place and look towards being prepared for phased reopening. Well, first of all, it will be going to the New Orleans City Council next week. I believe on Tuesday is our budget committee meeting, meaning that of the council. The city of New Orleans, particularly my administration, has been very much intentional and prudent in how we manage the public's money. As a result, based on our existing conditions, we want and we need access. It's about liquidity, access to cash in the event of. And so you have to plan. So this is a first step in planning for, should we need to access cash in this situation that we're in, then we will have it to access and to operate government. But it has nothing to do with losses or filling in gaps, if you will, in terms of lost revenue. Mm-hmm. 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 Sure. We will have more coming to you on that next week, actually. We're preparing for that right now. We went through a process this week where my department leaders had to submit to me and the CAO cost reduction strategies for their department. We're combing over them right now, and that will guide us in how we will deal with the losses that the city is experiencing. But I will be providing you more on that at the top of next week.
Yes, absolutely. And if you look at them, they're all fairly consistent across markers, or with some little nuances. But everyone is trying to create a standard approach so that we don't have 50 different sets of guidelines or 1,000 different sets of community guidelines.
Are there some significant bills? Are there some significant bills not being discussed during this legislative session that you're concerned about?
The upcoming legislative session, the focus there is just, the budget, them having to pass the budget and deal with the revenue losses. But in terms of the upcoming legislative session, the administration just remains focused on the initiatives that we were pre-COVID, and that is all aligned with infrastructure, sewage and water board and the like. Okay, thank you all so much, and continue to be safe. I didn't realize I was using that SPC, I call it SPCA.